So SDI-Kenya and IIED were able to roll out the VFL tool in the 13 villages in Mathare. The VFL tool basically gives opportunity for community to collect information regarding some of the most pressing threats they face at the community level. And the tool is fashioned in a way that community are able now to collect the threats, information in regards to the threats that they face, the barriers to addressing some of these threats, and the possible solutions that they see fit. So the tool was administered in all the 13 villages in Mathare, and in a nutshell, some of the priority threats that were identified include insecurity, fire outbreaks, unemployment, food insecurity, and disease. And just to note that these threats that I have mentioned were pretty much cross-cutting in all the 13 villages that the tool was administered. Next slide, please. So we also were able to focus on the harvest of the tool, from the tool. So through administering the tool, some of the harvests that were able to identify, champions came forth, and these champions, we were able to further carry forward some of these priorities that were identified after the VFL tool was administered in all the 13 villages. Another harvest, we have the core researchers and also the community residents were able to participate in exchanges. So we had teams attend exchanges with social justice centers where they were able now to learn and exchange knowledge. And one of the core learning point was the use of murals to further propagate messages, and also use that, or rather leverage on that, use of murals to sensitize around COVID-19. Another harvest we have from this, we had a formation of an environmental group in one of the villages in Mathare, 4B village. An environmental group called Mathare 4A Green rose from these specific VFL interventions with the VFL. Next slide, please. I'll give Rodgers to touch on this specific slide.
Thank you, and good evening, everyone. So I'll pick from Waithaka's left. So just to mention, we also saw an opportunity for the community members to come up with a physical and household address system, which basically, with this physical address system, our informal settlements are faced by so many questions. One of them being, how can you find your way around a constantly growing settlement? You find that our settlements, you can go to work in the morning, then when you come back in the evening, you'll find an incomplete structure in place. Another question that the physical address system tried to respond to is, how do you dispatch ambulances, the firemen, and even law enforcement personnel quickly during emergencies? For instance, during COVID-19, as Elvira has presented, there were so many cases of gender-based violence, police brutality. So with her physical address system and the household address system, it makes work much easier and response much quicker to rescue the affected personnel. Yeah. Another question it addresses is how you can you can locate facilities and even service points and even infrastructures within these informal settlements. So, for instance, during COVID-19, there was increase in reports of gender-based violence. So, how can you easily locate the rescue centers within our informal settlements? How can you easily locate the health facilities to even help expecting mothers during curfew time? Yeah. Another question it answers is how you can pinpoint breakdowns in water points, even electricity. And this one has been really helpful in Kosovo village, where Elvira was presenting about. Kosovo village, they were going through a challenge of electricity issues because of most of them, there is high level of illegal connections. So with this information, the community members are now in this ongoing negotiation with the government on how they can use the household address system, maybe through a model. Maybe they can replicate one that was used in Gulu, where they use the Mbakumi to address this issue of electricity. Another one is how to improve the on-site collection and reporting of community health data by the community health volunteers. So during COVID-19, as Elvira has mentioned, the community health volunteers supported the community members during that time. So with this, the household address system, it also gave our CHVs ample time to locate their households where they need to collect data and report to the health ministry. The last one, it addresses also how to improve provision of social welfare services, e.g. disaster relief, and even, for instance, the government introduced the cash transfer initiatives to support the vulnerable people within the informal settlements. Then there was a big challenge on how to locate the vulnerable people within the community. And the criteria they were using, how they can locate the orphans, the elderly. So with the household address system, it makes work much easier to identify these people within the formal informal settlements, and also reduce cases of corruption and even the irregularities that were somehow recorded during that time because of that huge data gap. Yeah, thank you.